A lack of prenatal care is unfortunately leading to babies filling up NICUs throughout our region. But even with the best of prenatal care, the unthinkable can still happen at times, and a baby is born too soon and too small. Smart Medicine correspondent Rod Starnes joins us now with a look at how advances in technology and treatment are giving the smallest of us a fighting chance at survival.
Going into the NICUs and seeing those precious children, they're so small, struggling for life, hooked up to those machines. It's heartbreaking.
Here in the neonatal intensive care unit of Baptist Women's Hospital, the struggle for life is a daily battle. With low birth weight playing a major role in infant mortality, these little ones are valiantly fighting the odds.
You can hold them in the palm of your hand. Life is rough on its best day, but when you come in with your respiratory system under stress and challenged, I mean, it's rough.
As the mortality rates grow, so does the need for better and more equipment to care for these infants, like the little guy who's snuggled inside here. If there is any good news to be found in this nationwide problem, it's that caring for these babies is becoming more specialized. Take, for example, this oscillator ventilator, the means to get much-needed oxygen into those precious little lungs.
And it's a ventilator that we can use for babies that are very small, have very sticky lungs that don't inflate well. And what happens is the oscillator vent will do 400 breaths a minute, which is just little tiny puffs to keep the lungs inflated, because preemies, one of their big problems is their lungs stick together, and so they can't inflate well. So every breath is like their first and takes a lot of pressure. When you do that much pressure on their lungs, then there's damage. The oscillator vent reduces the damage on their lungs.
Reducing stress on a preemie is a tall order. Just the job for this medical marvel, the giraffe bed. The elevating giraffe-like hood provides access for taller caregivers or a view of the baby for seated family members. It also acts as an incubator to control the infant's temperature and can even weigh the baby so he or she doesn't have to be moved around as much. And it provides side-to-side access ports so mom or dad can work along with yet another specialized caregiver.
We have a physical therapist, and we try to engage those families because the babies are at such a high risk for problems as they continue to grow, whether it's just survival or whether it's improving developmentally.
Becky Mitchell's little boy is certainly getting a workout today. Thanks to the accessibility provided by the giraffe bed, his physical therapist can work those arms, while mom makes sure he doesn't push himself too hard.
Mom's doing containment touch, so that helps him know where his boundaries are and know he's okay.
That's enough exercise for today. Time for baby to nap and let the machines do their jobs. And what a job they do. All of this technology, therapy, and research are paying off by reducing a number of complications that tend to crop up here in the NICU.
Intraventricular hemorrhage, which is the IVH, the bleeding in their head. We have seen a great improvement in that. We've also seen a reduction in our retinopathy of prematurity, which is preterm eyes, and babies having vision problems when they're older.
Fantastic news in making sure these babies live to see their first birthday and beyond. But there is a tremendous cost involved.
An average cost for caring for a premature baby is around $55,000, average cost. But in the newborn center at the Med, some of these babies cost up to $500,000 or beyond dollars. And imagine how much $500,000 or $1 million can do in providing basic prenatal care and basic medical care.
And as just about anyone else involved with the issue of infant mortality will tell you, this room is the last line of defense. A solution is going to have to come about much earlier in the process.
You know, I always say this, by the time I have a premature baby, the community has failed. This is a very expensive way to address the problem.
We're not going to put this off on the hospitals and the doctors and say, this is your problem, go solve it. A healthy baby begins with all of us. Somehow, we have to create the sense of urgency, the sense of immediacy, the sense of this is for me, so that the conscience of every person in this region says, boy, that grabs me. I'm not going to let any more of these little babies die.
So, Dr. Giancarlo Mari, let's talk a little bit about the costs associated with infant mortality. These young children who are very fragile, it's extremely expensive to care for them, correct?
Yes, it is. And I think that one of the greatest problems is prematurity. In the United States, the rate of premature deliveries is 12.8%. And at the Med, where we take care of a lot of patients with no prenatal care, and the rate of prematurity is 20%. So of course there is a problem. Now, the prematurity has to be seen not only for the cost that we have when a 23 or 24 weeks baby is admitted to the newborn special care unit, because we know the cost. We have seen Dr. Dani Reddy talking about the cost. But the cost of a 23, 24, 25 week baby is for the entire life, because now we have learned that a baby who has problems in the utero is, as an adult, more often will develop diabetes, heart attack, and so on. So the 40 weeks in the utero are fundamental. 30 years ago, scientists called the 40 weeks in utero as the vital weeks. Those are the weeks that will affect the entire life of an individual. And therefore, you can see also on the side the cost to the society.
And it's extremely expensive.
We are talking about not $500,000, probably $1 million for each one of these babies.
It's the whole lifetime.
Yes,
of
definitely
this
it is.
baby.
Yes, it is.
And so it's incalculable, really.
Yes, definitely.
But let's talk about, in a very general way, let's have a conversation about the cost to our community, because these numbers are being broadcast and published all over the country and all over the world. And you know these numbers better than the average viewer here, but they're astonishing. The numbers that we're seeing in terms of infant mortality. And some of our viewers maybe think, well, this is really not my problem, it's not happening in my family. But when we look at the hard, cold statistics, it's a meaningful indicator of our community's health, it's a meaningful indicator of our community's development. And when third parties, like companies that are examining whether or not to come to Memphis and Shelby County, look at this number and are astonished by it, and might be taking into consideration how we care for the least of those among us. So it really is, isn't it, Dr. Robinson, a much broader issue than just for impoverished people just scraping by who happen to be pregnant?
It very much is an issue for all of us, and for the corporate community, for corporate Memphis. I think the message is not one that we ideally want the world to hear about Memphis. When we talk about the infant mortality rate, particularly among African Americans, and we are a majority African American city, with that rate being 19, that rate is worse than the rates, as we've mentioned earlier, than Sri Lanka or Mexico or Botswana or Panama. That's not the message in terms of recruiting talent to the city. And when we then begin to look at this association of a variety of factors, race and poverty and lack of education, and the issues that are pervasive not just in Memphis but in every large urban African American city, then we are looking at a picture that often is focused, as you've indicated, in an index or an indicator, a public health indicator, such as infant mortality, and it speaks volumes. When an adolescent gets pregnant, she is 80% more likely not to finish high school. If she doesn't finish high school in Memphis Shelby County, then she is assigned to an ever downward spiraling cascade of a lifestyle, dependency on public assistance, and absence in the workforce. That has an impact on the Chamber of Commerce. It has an impact on corporate Memphis. It has an impact on not only her life and the life of that baby, and by the way, her baby is 20% more likely to be a low birth weight baby. 2/3 of the babies who die are low birth weight babies. So it's a terrible cascade and an aggregation of associations. It's not one thing, it's a multitude of things, which is why we're grateful for our mayor's leadership.